Hello everyone, welcome to this informative session. Today, let's talk openly about something many people experience but rarely discuss, a skin condition that can be uncomfortable and sometimes a bit embarrassing. I'm talking about skin boils. These localized infections can pop up unexpectedly, causing concern and discomfort. If you've ever had a boil, you're far from alone. It's a very common condition. These painful bumps can happen to anyone, regardless of age, lifestyle, or hygiene. They don't discriminate. There's absolutely no shame in it. Boils are simply a part of being human, a common skin ailment that many people deal with at some point in their lives. My goal today is to replace fear and uncertainty with understanding and knowledge. I want to empower you so you know exactly what's happening with your body and how to best care for your skin when these situations arise. Boils are among the most common skin complaints doctors see, and understanding them can save you unnecessary worry. They're a sign your body is actively fighting off an infection, a natural defense mechanism at work. It's important to remember that having a boil is not a reflection of your cleanliness or character. It's a common occurrence. We'll cover exactly what boils look and feel like, so you can identify them early on. We'll also delve into why they form in the first place, exploring the underlying causes and risk factors. I'll guide you through how to care for them safely and effectively at home, using simple and accessible methods. And crucially, we'll discuss when it's essential to seek professional medical help to ensure proper treatment. Plus, I'll share practical tips and strategies to help prevent boils from recurring in the future, empowering you to take proactive steps for your skin health. Let's approach this topic with compassion, curiosity, and a commitment to understanding. By the end of this session, you'll feel more confident, informed, and fully prepared to handle this common skin issue with knowledge and self-assurance. So, what exactly is a boil? Let's break it down in simple terms so you can understand what's happening beneath the surface of your skin. Simply put, it's a deep infection, not just a surface blemish. It's an invasion that goes beyond what you can immediately see. It all starts with a hair follicle, that tiny pocket in your skin from which a hair grows. The culprit is usually Staphylococcus aureus bacteria, a common germ that lives on the skin and can sometimes cause trouble when it gets inside the body. When these bacteria invade a hair follicle, your immune system responds, sending in its defense forces to fight off the infection. This leads to a painful, swollen lump, a clear sign that your body is at war with the invading bacteria. This lump is filled with pus under the skin, a mixture of dead bacteria, immune cells, and tissue debris. At first, a boil looks like a red, tender spot, small, almost like an insect bite, but it grows larger and more painful over a few days, becoming increasingly noticeable and uncomfortable. The area becomes warm, swollen, and inflamed, indicating the infection is active and spreading, and eventually develops a yellow or white head, a telltale sign that the boil is reaching its peak. This head forms as pus collects near the surface, signaling that the body is trying to expel the infection. This entire process, from the initial red spot to the formation of the head, can take days to weeks, depending on the severity of the infection. And the pain often throbs, especially if the boil is in a spot that rubs against clothing, causing constant irritation. Unlike pimples, which are usually superficial and less painful, boils are deeper and more painful, rooted in the hair follicle and involving a more significant infection. They can appear anywhere with hair because they originate in hair follicles, but are most common in sweaty, friction-prone areas like the places where your skin rubs together, such as the armpits, the inner thighs, and the buttocks. Understanding this helps explain why boils show up where they do, often in areas where bacteria can thrive and hair follicles are easily irritated. Recognizing these signs early is the first step to managing them effectively and preventing potential complications. Why do boils happen? The main cause is bacteria, especially Staph aureus, entering the skin through cuts, scrapes, or irritated follicles. A weakened immune system, diabetes, or certain medications can make you more prone to boils. Poor hygiene, sweat, and friction from tight clothing also increase risk by irritating the skin and allowing bacteria in. Sharing personal items like towels or razors can spread bacteria, which is why boils sometimes run in families or teams. Skin conditions like eczema or acne can also make it easier for infections to take hold. Remember, it's not about being unclean. Bacteria are opportunistic. Knowing your risk factors helps you take steps to prevent boils. Early on, a boil appears as a small red tender lump often mistaken for a pimple or insect bite, but it feels deeper and more sensitive. Over days, it grows larger, more swollen, and increasingly painful, with redness spreading around the base. The pain shifts from mild tenderness to a throbbing ache as pus builds up inside. A yellow or white head forms at the center, signaling the boil is ready to drain. The skin over the head becomes thin and fragile, and the boil is at its most painful just before draining. Sometimes you might feel unwell, develop a fever, or notice swollen lymph nodes, especially if you have multiple boils, a carbuncle. These are signs the infection is more serious. Recognizing these symptoms early helps you manage boils effectively. If you notice systemic symptoms, it's time to pay close attention. Early action can prevent complications. If you notice a boil forming on your skin, it's important to resist the urge to squeeze or pop it. Squeezing can actually worsen the infection by pushing bacteria deeper into the skin and surrounding tissues. This can lead to a more severe infection and increase the likelihood of scarring, leaving a permanent mark long after the boil has healed. Instead of squeezing, a much gentler and more effective approach is to apply warm compresses to the affected area. To prepare a warm compress, simply soak a clean cloth in warm water. Make sure the water isn't too hot to avoid burning your skin. Gently place the warm compress on the boil for 10-15 minutes, repeating this process 3 to 4 times a day. The warmth from the compress helps increase blood flow to the area, which is crucial for healing. This increased blood flow encourages the boil to naturally come to a head, making it easier to drain, and it also provides soothing pain relief. Maintaining cleanliness is paramount throughout the healing process. Always wash your hands thoroughly with soap and water before and after touching the boil or changing the dressing. This prevents the spread of bacteria and minimizes the risk of further infection. Once the boil eventually drains on its own, gently wash the area with mild soap and water to remove any discharge. After washing, gently pat the area dry with a clean towel and cover it with a sterile bandage to protect it from further contamination. Change the dressing regularly, at least once a day, or more often if it becomes soiled, to ensure a clean and protected environment for the healing skin. Be patient and allow your body the time it needs to heal. Remember that healing takes time, and attempting to force the process can lead to unwanted complications, such as a deeper infection or more significant scarring. It's crucial to never attempt to pierce a boil with a needle or any other sharp object at home. This can introduce bacteria and significantly increase the risk of a more serious infection. Allow your body to heal naturally with the help of warm compresses and proper hygiene. Continue applying warm compresses for a day or two, even after the boil has drained, to promote complete healing and prevent recurrence. Proper care not only speeds up the recovery process, but also significantly reduces the risk of spreading the infection to other parts of your body or to other people. When it comes to dealing with boils, safe and gentle steps are always the best approach for effective healing and preventing complications. Most boils heal at home, but some situations need a doctor's attention. Seek help if you have severe or worsening pain, a fever, or feel generally unwell. These could signal a spreading infection. Red streaks radiating from the boil or boils on your face near your eyes, nose, or spine require urgent care. Large boils, clusters, carbuncles, or boils that don't improve after a week of home care should be seen by a professional. Recurrent boils may indicate an underlying health issue, like diabetes or persistent staph colonization. A doctor can drain stubborn boils safely and recommend further treatment if needed. Don't hesitate to get help. Your health comes first. Preventing boils starts with good hygiene. Wash your hands often and shower daily, especially after sweating. Keep friction-prone areas clean and dry, and avoid sharing towels, razors, or personal items. If someone in your home has a boil, wash their bedding and towels in hot water. Clean and cover any cuts or scrapes promptly to block bacteria from entering. Use a clean razor and shave in the direction of hair growth to avoid nicks. Support your immune system with a balanced diet, regular exercise, and enough sleep. Manage chronic conditions like diabetes to reduce your risk. Small changes in daily habits can make a big difference. Prevention is about protecting your skin and your health. Take care of yourself, inside and out.